Time now for a look at your health. You know, of course, acne can be a big problem when we're teenagers, but what happens when it returns as adults? No fun at all. Well, Dr. William Groff is joining us now to talk more about adult acne. Thank you for being here.
Thank you.
All right, Dr. G is on his honeymoon, so he's pitch hitting today. Tell me, why the onset of adult acne? What prompts that?
Well, for a lot of patients, it's not the onset in adulthood, but it's just a continuation.
Is that right?
Yeah, absolutely. But for a lot of women, sometimes fluctuations in hormone levels with pregnancy, maybe as they get near the menopausal age, can cause a flare of acne as well.
So are those the main differences between teenage acne and adulthood acne?
Well, hormones definitely play a larger role in women, you know, with estrogen levels changing, but the primary cause of acne are essentially the same and can be treated the same.
All right, well, let's talk about some of the things that can make it worse or better. Is diet a part of that, or?
That's an interesting point. Until about 5 years ago, we thought that diet didn't really play a role, but several studies have come out showing that milk and dairy products in a small subset of patients can make their acne much worse. Now, milk is very good for you, and especially for a growing teenager or even for women who need milk to protect against osteoporosis and things. So I'm not suggesting not to drink milk, but if you have really bad acne and you're not responding, you may want to try to eliminate milk for a little bit and see if it gets better. All
right, well, let's take a look at some before and after pictures that you were kind enough to bring along, talking about some of the treatments. Tell us what you did here.
This is a patient of ours that we treated with, we have about 5 different lasers in our practice that we can treat acne, and this gentleman has some pretty bad scarring, as you can see, and with one treatment we were able to essentially eliminate probably 80 to 90% of his acne scarring.
All right, and what is this one reveal?
This one's a patient with active inflammatory acne, and we were able to do a procedure called PDT, which is a light-based therapy. We put a topical solution on the skin and then expose the skin to light. It has really almost no downtime, and this is the same thing here. You can see some really remarkable results. And a lot of patients don't want to take pills. They don't want to use creams on their skin that can be irritating or inflammatory. So a lot of patients love to do these laser procedures because there's really no downtime and you get some really nice results.
And really, they weren't around, you know, years ago, and it was a self-esteem issue for people, and so that's nice. There's a way to eradicate it. Well, thank you, Dr. Groff. It's so nice to have you here. And hey, we got some solutions for what can be really a terrible problem to take you into adulthood.
All right, thank you.